It's essential to keep blood sugar levels steady for general health and well-being. Variations in blood sugar levels can result in diabetes and other metabolic disorders, among other health problems. You can control the amount of sugar in your blood and enhance your quality of life by avoiding specific blunders. We will examine the 50 fatal errors to avoid in this video in order to normalize glucose levels. So let's get going. Number 7. Leaving out breakfast. We frequently skip meals because of our hectic schedules, which has an impact on our blood sugar levels. The majority of Americans frequently skip breakfast. The most significant meal of the day is breakfast. Breakfast deprivation causes blood sugar levels to rise. Eat a nutritious breakfast that is packed with many different nutrients. A well-balanced breakfast full of fiber, protein, and beneficial fats will help control blood sugar levels and lower the likelihood of later overeating. Number 6. Taking medication improperly. Around 60% of diabetics, according to Yale Medicine bariatric surgeon John Morton, do not take medicines exactly as directed. He claims, "This is a greater issue than we thought." Morton advises speaking with your physician, a nurse instructor, or a pharmacy technician if you're unsure of how to take your medications. Never alter or skip a dose. George Moreno, MD, an expert in obesity medicine at Yale Medicine, believes that continuing to take the diabetic medication you're now taking is not an option. Talk to your doctor about your work schedule. According to Moreno, you may require to take your medication at an alternative time than recommended on the drug label if you work a nighttime shift. Never alter or skip a dose. Number 5. Unneeded beverages. When you have diabetes, dehydration is easy to develop. Additionally, if you don't have sufficient water in your body, your blood sugar may rise. However, some drinks can cause an increase in your blood sugar. People who have diabetes are advised to drink more water, claims Moreno, so they proceed to drink 100% juice to hydrate. Unfortunately, that is quite sweet. You must substitute water for alcoholic, sugary, or cold beverages. Ask your doctor if it's okay to drink beverages with artificial sweeteners. More study is required to determine how they affect blood sugar. If you really don't like water, though, Moreno suggests that diet or zero drinks may be an alternative. Number 4. Skipping a workout. Your blood sugar can be lowered and your body can respond to insulin more effectively with regular aerobic activity. Additionally, don't overlook strength training. Moreno advises seeing muscular tissue as a sponge. It takes up glucose. Adding more exercise to your day will help, particularly 15 minutes after a meal. Go for a stroll. Work out using your own weight, etc. Whatever method you use, make sure you exercise for a minimum of 20 to 30 minutes each day. If you only have a few 5 to 10-minute chunks to do your task, it's okay to do so. Strength training should be done at least twice per week. The less sugar there is in your blood, according to Morton, the more muscle you gain and the greater amount of energy you expend. Number 3. Ignoring medication and supervision. Even if you eat well, take your medication, and exercise sufficiently, you still run the risk of developing other health problems if you have diabetes. It could be difficult for you to recognize when things begin to go wrong. Don't take anything for granted, Morton advises. Make sure you conduct your testing regularly. Every time you see the doctor, you might need to have a few tests done. Once or twice a year, others might show up. Find out from your doctor what is best for you. Your blood pressure, cholesterol, foot health, eyes, teeth, and gums, as well as your kidneys, will all be monitored. Number 2. Getting insufficient sleep. Improper sleeping habits are linked to a number of health problems. Less than 7 to 8 hours of sleep per night increases your risk of developing certain medical conditions. Another effect of poor sleep is an increase in blood sugar levels. Less sleep, according to the National Sleep Foundation, NSF, might cause blood sugar levels to rise. As a result, diabetics need to keep their sleeping habits consistent. If you are having difficulty sleeping, let your doctor know. To help you relax, they can recommend changing your habits. Additionally, they will look for any health issues, including obstructive sleep apnea or insomnia. Number 1. Avoiding mental health issues. You should include mental health care in your diabetes treatment strategy. Depression, stress, and other factors can have an impact on your blood sugar. One reason, according to Moreno, is that you may forget to take your medication. Your body is also prepared for action by stress chemicals. Your body releases extra energy when stressful events arise, so you can run away or fight. It says, Let's gather all of our possessions here, and that implies sugar, according to Morton. Stress can't be eliminated, but you can develop better coping mechanisms. Ask your physician to recommend a professional in the field of mental health if you are unsure of where to begin. Practice yoga, read books, and hang out with people you care about. Conclusion: a comprehensive strategy involving dietary decisions, physical activity, stress reduction, and adequate sleep is needed to normalize blood sugar levels. You can manage your blood sugar levels, lower your chance of developing chronic diseases, and live a healthier, more energetic life by avoiding these 10 fatal blunders. Before making large dietary or lifestyle changes, always seek medical advice, especially if you have ongoing health issues. All of that came from our end. What works best for you to control your diabetes? Please share in the comments section, and be sure to subscribe and like the video if you enjoy it.